I'm Omar Kenyatta Clark, an advocate, overcomer, and hope speaker who's faced life's hardest challenges head on. On this podcast, I bring you honest conversations, real stories, and practical wisdom to help you heal, grow, and rise stronger than ever. This is Voices of Hope, where we turn struggle into strength, pain into purpose, and isolation into connection. If you're ready to break free from what's holding you back, achieve true success, and become the best version of yourself, get ready for a journey like no other. Let's ride. Welcome to Voices of Hope, the podcast where we speak the truth about pain, purpose, and the systems that shape our healing. Today's episode might be one of the most important I've ever done. I need you to listen with your heart wide open because this isn't just a story about me. It's about the people we've failed. It's about the mental health system that's broken in ways the public can't even imagine. It's about the difference between life and death. It's about what happens when compassion disappears from care. What you're about to hear is real, unfiltered. At times, it might make you feel uncomfortable. But that's exactly why you need to hear it. We're going into hospitals. We're walking through psych units. We're confronting the shameful gap between what's promised and what's actually delivered. And most of all, we're asking the question that too many people in power avoid. Where is the compassion? Let me take you back to where it all began. The first time I had a psychiatric emergency, I didn't get help. I got handcuffs. I was taken to a regular ER, not a psychiatric emergency room, just a general hospital. There were no mental health specialists, no trained crisis responders, just fluorescent lights, overwhelmed nurses, and cops who had no idea what they were doing. What I needed was compassion. What I got was containment. What I needed was connection. What I got was criminalization. I was scared, vulnerable. My mind wasn't right. And instead of support, I was treated like a threat. That moment changed me, not just emotionally, but fundamentally. It taught me something I wish I never had to learn. Where you go in a mental health crisis can mean the difference between recovery and tragedy. Most people don't know that, not until it's too late. And that's why I'm here, on this mic, telling you this story. Because people are dying, not just from mental illness, but from a system that doesn't know how to love them through it. The second time I had a psychiatric emergency, I made it to a psychiatric emergency room. And that choice saved my life. Stony Brook Hospital, CPET. I'll never forget it. Now let me be real. It wasn't perfect. The trained professionals, the nurses, psychiatrists, social workers were behind protective glass. At first, I felt like I was on display. Like I was some kind of zoo animal. They could see us, but we couldn't really see them. It made me feel dehumanized. But after being there for a while, I understood. Anything can happen in a psych ER. People can be in full-blown crisis, unpredictable, volatile. The glass was for their safety, for them and for us. And despite that barrier, they still showed care. There were psychiatric aides who stayed in the room with us. They offered food and snacks, played cards, talked to us like people. And when I needed it most, they gave me psychiatric medication to calm the storm in my mind. But here's something most people don't realize. There's a severe shortage of proper psychiatric emergency rooms. Stony Brook Psych ER was so overcrowded that the hallways were lined with stretchers. Patients were on gurneys in every corner because there simply weren't enough beds. And the problem didn't stop there. There's also a major shortage of inpatient psychiatric beds across hospitals in general. When you're admitted to a psych ER, you're supposed to be stabilized and then transferred to a full psych hospital unit. But often, the transfer takes days, sometimes longer. People sit in the ER waiting for a bed to open up, and that delay can be dangerous. And when you finally do get transferred, You're often so sedated, so disoriented, that by the time you wake up, you have no idea where you are. I never forget one particular night at a psych hospital. Several patients had been transported from the Bronx all the way to Long Island. Nobody told them where they were. They were loaded into an ambulance, sedated, and dropped off like packages. I saw the fear in their eyes, pure confusion. Some were still groggy, asking where they were, what was happening, and no one told them. No staff member stepped in to explain. So I did. I told them where they were. I welcomed them. I helped them understand what was going on, not because I had to, but because someone had to. It broke my heart. These are human beings in the most vulnerable moments of their lives, being shuffled through a system that treats them like numbers. That's why I speak. That's why I share this, because people deserve better. I wish I could tell you that every psych hospital is built to help people heal, but that wouldn't be the truth. Let's be honest. The biggest difference between the hospitals I stayed in wasn't the furniture or the food or even the schedule. It was the level of compassion. Let me start with the worst. That place should have been shut down. The unit was infested with lice and mice. The staff, mostly indifferent. The nurse on the night shift would regularly sleep through her shift while patients wandered the halls unsupervised. There were days we were lucky to get even one fresh air break. There were fights that went unaddressed, and even getting a cup of water felt like a battle. The food was scarce, and the environment was filthy. One night, an elderly man defecated in his bed and was left there for hours. The smell filled the entire unit. There was no escape from it. But the worst part, the staff didn't seem to care. The nurses ignored us. The social workers were nowhere to be found. And the psychiatrists didn't look at me like a human being. They looked at me like a threat. I was just another body on a stretcher, another chart in a pile. It's almost impossible to heal when you're treated like you don't matter. Other hospitals were better, at least in the basic standards. Cleaner, more staff, stocked fridges. They followed protocol, but it was still cold, clinical, and impersonal. But then there was Stony Brook. That's where I found something rare. True compassion. The nurses didn't just hand out meds. They had conversations. The social worker actually advocated for me, helped me plan for my future. And the psychiatrists, they saw me, not just my diagnosis, me. That level of compassion changed everything. I recovered much faster in that environment, not because the meds were stronger, but because I felt safe, I felt seen, I felt human again. Compassion is part of the medicine, and it's often the one in shortest supply. But let me tell you something nobody warned you about. The hospital isn't the hardest part. The hard part is what happens after they send you home. You go from round-the-clock support, structure, and care to silence, to four walls, to your thoughts. If you were suicidal before the hospital, the risk doesn't go down when you leave. It goes up. I've lived it. I went from a structured hospital day to lying in my mother's bed for weeks. The meds knocked me out so hard I couldn't get up. My mom literally had to spray me with water to wake me up. And that was with support. Now imagine going through that alone. That's why I believe in the partial hospitalization programs, PHPs. They were bridge, 6 hours a day, group therapy, one-on-ones, meals, medication, real support, real healing. I was lucky to experience that once, just once. But most people aren't. Wait lists are long, access is limited, and so people fall through the cracks. Again, even after you survive the hospital, even after you stabilize, the struggle doesn't end. Imagine being in the middle of a breakdown, your mind is fogged, you're desperate, your thoughts are racing, you know you're not okay. You need emergency medication. So you call the number they gave you after discharge. That number sends you to another. The second sends you to a third. Then the third sends you right back to the first. Meanwhile, you're spiraling. The system is spinning you in circles and no one is helping. That happened to me. I was asking for medication to stabilize my mind, but in a full psychiatric crisis, the only person who stepped in to help was my primary care doctor, not a psychiatrist, not a crisis team, just my regular doctor. That's how broken this system is. There are programs called PROS, Personalized Recovery Oriented Services. They're supposed to help people reintegrate, but in reality, a lot of them feel like adult daycares. They're inappropriate for many people, especially those who are young, ambitious, and trying to reclaim their independence. And then you try to find therapy. You finally decide to seek help, and you hit another wall. I went to one clinic where the therapist and psychiatrist were both cold. No connection, no compassion. They didn't see me. They didn't hear me. At another clinic, I was literally turned away. They said I was too severe of a case. Let that sink in. Too sick to be treated? In a place that exists to treat the sick? So I turned to private therapy. And I'll be honest, it helped. But the cost? It crushed me. I literally went bankrupt trying to pay for mental health care. My therapist knew I was struggling financially, so my mother had to start paying for my sessions just to keep me afloat. But despite that, no discount, no sliding scale, no offer of help, no compassion about my financial situation, even after years of working with that therapist. And that's something no one talks about. Many of the best therapists don't take insurance. They don't want the hassle. They want freedom. They want lifestyle. Who gets shut out? The most vulnerable people, the poor, the traumatized, the people living with conditions that make it hard to even keep a job, let alone a steady income. Where is the compassion? Because people are dying, rich and poor, white and black, in suburbs and cities. People are dying because they can't access the help they need. And the few who can get in often feel like just another appointment, another note in the file. This is what we've accepted as normal. This is what we have to challenge. Because healing can't happen without humanity. And humanity without compassion is empty. To the mental health professionals out there, if you've chosen this work as a path to power, prestige, or a paycheck, step aside. If you treat patients like they're beneath you, if you refuse to take insurance while charging $200 a session, if you've normalized detachment and called it professionalism, you are part of the problem. But for those who care, those who want to change this, here's how we start. It starts with education. We need to understand the difference between a general emergency room and a psychiatric ER. And we need to make sure others know that difference too. So please share this. Then comes advocacy. We must support policies that expand access to mental health care and fund programs that are built on compassion, not just compliance. We need to normalize these conversations. Talk about mental illness the same way we talk about diabetes or high blood pressure. No more shame. No more silence. We must support peer-led initiatives and survivor-run organizations because they often provide the most authentic, empathetic, and effective care. And for those in the system, therapists, psychiatrists, social workers, nurses, do better. Take insurance. Offer sliding scale fees. See people as human beings, not just diagnoses or data points. Show up with your heart, not just your credentials. And to those who are suffering right now, you are not the problem. Your life matters. Your pain is not a punishment. You are not too much. You are not too far gone. You are not alone. Healing is possible. Not easy, not fast, but possible. You've already survived the fire. You are still here. And that means there is still hope. So hold on. You've just heard the truth, unfiltered, uncomfortable, and absolutely necessary. This system is broken, but we are not. You are not. If you are still here, it means you carry a spark, a refusal to accept the injustice and neglect that have become the norm. Not one more person should endure the coldness, the confusion, the endless loops of a broken system. Not one more life should be pushed to the edge because the help they need doesn't exist where it should. To everyone who has ever felt invisible, discarded, or dismissed, hear this. You are not alone. You are not broken. The system may have failed you, but you have never failed yourself by asking for help. If you are still fighting, still showing up, still breathing, then you are stronger than you know. Your resilience is a beacon. Your pain is a call for change. To the professionals, doctors, therapists, social workers who hold the keys to the system, this is your moment to answer the call. We need more than your degrees and protocols. We need your humanity. We need your compassion. We need you to stop hiding behind paperwork and billing codes and truly meet us where we are, vulnerable, scared, and desperate for connection. Change begins here. Change begins now. And change begins with stories, with truth told loud and raw, with voices refusing to be silenced. If this episode has stirred something in you, let it burn. Share this story. Hold tightly to your worth. Turn your anger into action. There are thousands, no, millions, right now trapped in the maze of neglect I described, lost and unheard. They need you. They need us all. Hope is not a distant dream. It's a living force, birthed in the quiet bravery of those who keep showing up, and strengthened in the sacred bonds of community. It's shaped not just by pain, but by our shared determination to build something better. Together. It lives in the hands that reach out instead of turn away. It moves in the voices that speak up for those who can't. It grows in the moments when we choose unity over silence and love over indifference. Because real change doesn't come from a single voice. It comes from a chorus. It comes when survivors, advocates, professionals, families, and neighbors rise with one heart and say, we deserve better. We will do better. And we will do it together. Let this be more than a moment of awareness. Let it be the beginning of a movement rooted in compassion, driven by justice, and carried forward by community. Let it be the spark of reformation, a sacred rebuilding of a system that sees people first, that listens deeply, and that serves with dignity. This is your call to speak, to share, to show up, to build bridges, not walls, to stand with those who are suffering, not above them, to carry this truth into your circles, your communities, your profession, and let it change how we care for one another. Because when we come together, truly together, there's nothing we cannot change. And when compassion leads, healing follows. This is not the end of an episode. It's the beginning of a new chapter, a turning point where we stop waiting for the system to change and become the change ourselves. Together, let's rise, not in rage, but in resolve. Let's reform, not in isolation, but in solidarity. Let's make sure the next person who reaches out for help doesn't have to fight alone, because we are more powerful than we know, especially when we move as one. And that's where hope lives. In us, with us, because of us. And it starts now. Next week, we bring it all home. The season 1 finale of Voices of Hope drops next week. And trust me, you don't want to miss it. I'm bringing together everything we've talked about this season, every fire I've walked through, every lesson learned, every voice that's been ignored, and every bit of hope I've carried with me through it all. We're not just looking back, we're looking forward. Because the journey doesn't end with survival. It continues with purpose, with service, with light. So if you've ever felt lost in the dark, if you've ever wondered if your voice matters, or if you've questioned whether you're strong enough to help others heal, the finale is for you. Until then, I'm Omar Kenyatta Clark, and this is Voices of Hope. Want to be part of what's next? Email me, omarkenyattaclark@gmail.com. We're just getting started, and next week, we rise. Thank you for joining me today. If this episode spoke to your heart, share it with someone who needs encouragement, healing, or a reminder that they're not alone. You can follow me on Facebook at Omar Kenyatta Clark or Instagram and YouTube at omar.kenyatta for more inspiration, updates on the Omega Principles, and behind the scenes from this journey. Remember, true success isn't just about what you achieve, it's about who you become. So keep rising, keep healing, and above all, keep walking with purpose. I'm Omar Kenyatta Clark, and this is just the beginning. Until next time, let's rise.